Sudan, like most of the other countries in the Horn of Africa, they are prone to get zoonotic infections. And this has occurred for the past at least 100 years. There were so many outbreaks of zoonotic infections. Most of them were viral infections, although there are lots of parasitic infections and lots of bacterial infections. I mean, in Sudan, as like in the other African countries in the Horn. Recently, the most prominent outbreaks were arboviral infections. And this have occurred so many times that people are starting to struggle and to fear about the risk factors that are happening, that are causing zoonotic infections, especially arboviral infections, to occur, like outbreaks of yellow fever, outbreaks of dengue, outbreaks of other arboviral infections in the Sudan. I started off in my career working on waterborne diseases, especially bilharzia, schistosomiasis, and malaria. And when in the bilharzia, we had joint work with the bovine schistosomiasis projects, and because the bovine schistosomiasis vector is the same vector for human urinary bilharzia. And I was working on the urinary bilharzia, so understandably I had to do a lot of with the bovine infections as well. And of course, that was in the late 70s, I think. And we were working on having a vaccine for the bovine schistosomiasis, which worked under those conditions. It worked perfectly. So we had lots of work on the vaccines productions, and then we started off working on other zoonotic infections like leishmaniasis. That's when I got my PhD, and then I started being director of the institute itself. So I worked on leishmaniasis, I worked on tuberculosis, and I worked on another very specific parasite, which is, I had a student working on it. It's called Linguatula serrata. And it is a parasite which is normally a nasal parasite of dogs. And then dogs can excrete the eggs or the nymphs, and then cattle or sheep eat the nymphs, and then the parasite grows or becomes in sheep. And then humans, when they eat meat of this sheep, they can get the infection through the nymphs. It's called Linguatula serrata, and usually it causes irritation of the throat for those people who eat raw meat. And then after that, I started working extensively with malaria, schistosomiasis, leishmaniasis, and arboviral infections. And now I have 2 or 3 of my students are working on arboviral infections. Interdisciplinarity between the different professions sometimes is very difficult to work out. And we have been I've been insisting on having, interdisciplinarity in the university curricula, so that the medical profession, they should know about animal zoonotic infections, and the veterinarians, they should know about medical, and then of course the agriculture and the other related faculties. So we have insisted that One Health component should be included in the curricula of these related faculties. And then for postgraduate, we have been also insisting that there should be collaboration and multidisciplinarity in working projects and programs, so that we can have the One Health component worked out. And that will be for agriculture, veterinary sciences, for medical sciences, for environment, and then for the social sciences, of course. Because diseases in communities, there is a lot of social sciences that has to be included, so that you know how the communities, they get exposed. And of course, in the Sudan, like most of the other countries in the Horn of Africa, there are many or lots of animal resources, and people work or own or take care of these animals as a profession. It's part of their life. Having animals, domestic animals, is part of their life, of their living. And they have close contact with the animals, and they have, through this close contact, they are exposed to infections. So if we want to deal with these infections, zoonotic infections between animals and humans, we have to do the social sciences in the background. That what causes humans to be exposed to infections of animals rather than keeping away from the animals and doing it. So this needs to be a multidisciplinary approach, and then it needs a lot of awareness, and it needs a lot of environment work and supervision of those who work in the environment as well, like in the agriculture. The farmers, they should know that the infections that they are passing between animals and humans, they are caused through their practice in their daily life, like exposed to for example, bilharzia, to urinary schistosomiasis. They have to go to the canals and to do the cultivation, but they have to know that the water is bound to have infections. So we need to educate the communities properly, and of course we have to avail the services that would work for a good public health approach and protection, and reduce the risk factors which affect or cause the humans to go into the areas where they are getting the infection. One health approach, we will be dealing with the SDGs. We have to consider all the 16 SDG conditions, and then the 17th is on partnership. And I think this is the most important component of the SDGs, because it will guarantee that people will collaborate and there will be partnership between the different institutions, the different agencies, and so on. And of course, in developing countries, partnership is very important because there is lack of funding and finance and establishment within the institutions, and there should be collaboration with other institutions, and that should be a North-South collaboration and the South-South collaboration. I mean, it's not that always we have to look for the EU and for the international agencies. We can coordinate and collaborate the African countries with each other. So partnership is a very important component if we want to do the One Health, and we have to work that. And it is not the matter that who leads. The whole thing has to be led by us all. All of us should be considerate, and leadership would come when it comes to projects and things. But the understanding should be a shared understanding. The people should coordinate and collaborate. And after all, it is one world that we are all living in. It is not that each one of us has his own world, or each country has its own world. I have seen this clearly in the COVID. I mean, it didn't take long for all the countries to have the infection. So any outbreak would happen very quickly, and now we see it with the what do they call it? The monkeypox. Now it is coming up, and I hope it is not going to be very serious, but it is coming up. So it means that all of us should be careful. All of us should be understanding, and we should coordinate and collaborate. Each one in his own or her own position should consider things clearly with an understanding that it is a multidisciplinarity approach rather than a single approach for fun. If we want to really establish or to get to the SDGs by 2030, we have to consider this partnership very seriously, and we have to work towards that. And we have to coordinate our activities and projects. For this, I want to stress that Sudan has been sanctioned for the past 30 years because of the government, and still we have lots of problems now going on with the political situation. But unfortunately, the sanctions has caused a lot of damage to research, to international projects, international funding, because the sanctions were mainly on the financial resources. And we didn't have much money to sponsor projects on disease control. So although most of our country, the other countries in Africa, they had lots of project sponsorship and support, but Sudan was deprived with lots of other projects that we did not get support from other countries or coordinate and collaborate with other countries. So now we look forward that Sudan should be reconsidered in the international understanding and the coordination and the partnership, so that we can achieve the development, the sustainable development goals by 2030, like other African countries. There is a lot of work going on in Sudan, but still we need the support from external agencies and coordination and collaboration with other countries, South-South or North-South. Of course, monkeypox has been known, but not much has been known about it. And we haven't seen cases yet, as far as I know. We haven't seen cases of monkeypox in the Sudan, or at least I don't know of any cases coming to Sudan. It is out in Europe, America, Australia, and Canada, but we haven't seen any cases yet. Of course, knowing about what happened in COVID, we have to deal with monkeypox seriously, because protection, and if it is a public health concern, we have to deal with the environment, and it's a human behavior. And we have to have, awareness to the, of the people, the communities, about the infection itself, and the public health, precautions that we have to do. And we have lots of, educational material that has to come up. And people should know that if there is a case of monkeypox, they have to be very careful and to protect themselves and to wear the mask and not to touch and so on, like what happened in the COVID at the beginning. And of course, the medical personnel, people dealing with the patients, they have to be alerted, they have to take it seriously, and they don't have to really risk getting the infection from patients by being careless. After all, it is health education, surveillance, and awareness, and people taking the disease, the infection seriously. It happened also, not even the COVID, the bird flu. I mean, during the outbreak of the bird flu, there was lots of mismanagement, and people started killing mulling their chickens and so on. So people have to do things very meticulously, but they should not risk getting humans exposed to the risk factors which will cause the infections. And I think there is enough scientists and researchers and medical personnel and educators and public health people that can educate people once we have the regulations and the guidelines worked out clearly.